I start hearing that they're thinking of giving the vaccine to pregnant women. And I'm like, and this is an experiment. This is not even an approved. Back then I thought FDA was still the gold standard. So I'm like, this is not even FDA approved. It's just an experimental usage. So there were a lot of red flags that indicated to me that something larger was happening, either very corrupt or just a lot of mistakes or lack of oversight. I didn't know what it was, but I had red flags all over the actual, I don't call it a vaccine because it's not.
It's not a vaccine.
Experimental gene therapy. That's a whole nother thing. This was the first time we were going to use this type of genetic therapy on, it's like, it's a revolutionary mechanism of delivery.
Yes.
And shouldn't we be doing a lot of data collection and only giving it to certain population, the one that needed it the most? Why wouldn't you give this to children?
Here we are back on Podcast Twins from the infamous Twin Cave, as you've nicknamed it.
The Twin Cave.
We got
back.
Debbie Faris back. Thank you for coming.
Yes, indeed. We're
Vince,
so happy
tell
to
them
have
what
her
to
back.
do.
Okay, as always, I need you to subscribe to this channel. You can find us on every single platform. Make sure you like, share, and if you're on YouTube, click the little bell icon so you know when we're posting an episode. Don't want to miss anything. If you're my Spotify listeners out there on the road, especially over the road drivers, hey, make sure you keep enjoying it and leave us a comment every opportunity you can. We want to make sure everybody gets to hear everything we
If you know somebody that will hate everything we say, send it to them. If you know somebody that will like everything we say, send it to them.
Directly.
So,
tag them.
We brought Debbie back because Vince has some questions about
so
what it is that you actually do.
Yeah.
And also, you got some updates from our last episode as well. So, Vince, why don't you ask your burning question to start us off today?
Well, because we sort of, we grazed across it.
Right over it.
And it just, it touched my brain a little bit. You know, it's soft already. So we got to make sure that it gets understood. So explain to me the title in which you do in the political side of the world and how that works and how you say, because it's not a lobbyist. Tell me the difference.
Okay, so a lobbyist is someone that gets paid.
Mm-hmm.
And don't get me wrong, I think lobbyists at one point were very important for legislation purposes. Because,
how many years ago?
Let's just say 30 years ago.
Okay.
Because you had, when you're elected to public office, say you're a congressman or a representative, you might come from the insurance industry, but you don't know anything about agriculture. You don't know anything about water. You don't know anything about airways. So what lobbyists used to do was to provide information and to educate the legislators so that they could make informed decisions. And that was an integral part of the process.
Okay.
Now, lobbyists now have a very different connotation because they basically, we could totally unpack that.
Yeah.
So
Vince calls them the pimps and the hoes, but go on.
Well, you know what? I don't have to unpack it. I think you described it.
Yeah, because, right.
So
have dollars will travel.
Exactly. So
Okay.
what I do is I do the same. I go and inform legislators, but I don't get paid. So that's why I'm a political advocate.
Okay.
And the space that I operate in political advocacy is in election security. And I like to call it election security because a lot of people say election integrity. We do not have integrity. So that's why we have to have security.
Okay. All right. That's a real American answer right there. All right. So the question I have to back that up is, are you making the security based on the party or the process period?
It's entirely on the process.
Okay.
It's entirely on the process. So what, for example, is going on here in Florida? You have a list. You can go and check. You know what? This person is 94 years old. They've been voting. They're 120 years old. They're also voting. Let's knock on their door, see if they're still living there.
Okay.
So our movement, it's called Defend Florida. We started doing this 5 years ago, and we realized that marinas that had 20 slips had 80 people registered to vote to them. Trailer parks that had 80 slots had 400 people registered to vote. So this is what's called ballot harvesting, where you have someone that can receive because they're in the voter rolls in the database as a active voter. So you might know that that person doesn't live there anymore. They've moved to Minnesota. They've moved to another state, but they're still there. So if you know where they are, you can start collecting those ballots.
Okay.
So if both parties, let's say, for argument's sake, I think you had at one
Both
point
parties
said
do it.
both parties
Right.
cheat.
I know that those.
Why is this a bipartisan issue? Why wouldn't both parties want security if they think they're the
Because
best?
the party that's in power right now thinks that they will always be in power and they know how to cheat, so they want to continue.
And that's right now at any point
Well,
in
that's
time.
at
When
any
you
point.
say right now, you mean any
Whoever's
point
in
in
power.
time.
Exactly.
Okay.
Whoever's in
Well, see,
power.
I'm from Chicago, where the motto is vote early, vote often, vote forever.
Oh my.
So
Oh my.
Chicago politics has always functioned on that level. We probably got some 300-year-old people that still vote every
and have their
opportunity.
social security and
Oh,
now
yeah.
receiving Medicaid.
Probably still getting all that taken care of, you
Well,
know.
somebody's getting that money, right?
but-
It's
but-
not going into cyberspace.
And that's the only thing, in my opinion, that I'm very interested that Mr. Musk is supposed to be doing, is to find that particular answer, the excess. I'm not happy that he let the park ranger go, the guy that's making $37,000 that guides you through Yellowstone National Park, but it's the fallout. In other words, I'm thinking that.
Look, when you
Let me
have
go back to you.
Okay, and I'll give you an opinion on that as well. But what's going on right now, at least I can speak for in the state of Florida, there's several areas that legislatively, to me, make common sense. For
Okay.
example, we should be able to state that only U.S. citizens are able to vote in our elections.
That's not already on the books?
It relies on the person reporting, checking off a box saying,
Okay.
I am a U.S. citizen. So
So you don't have to prove it.
You don't have to. In some cases, there are places where you are required to prove it.
Okay.
But there are other places where you can enroll to vote, and you don't have to prove it.
Okay.
So,
I can tell you, and I may or may not have shared this with you, but not this past election, but the one before it, I got 5 mail-in ballots in my mailbox with my name on them, and I ordered a total of 0. So I know there's some fugazi stuff going on.
There's a lot
And my
going on.
wife was like, "Why do you keep ordering these?" And I'm like, "What are you, crazy?
Now,
I'm not ordering anything."
Were they
What
the
are you-
sample ballots or were they the actual real
Mail-in
deal
ballots. Mail-in ballots. I could have voted 5 times if I was a dishonest person. I could have voted 6 times, right?
those are-
5
But you could've went
times and
in.
then go in.
Right.
So those are areas where we the voter roll has to be cleaned up. That is a problem that has been fixed because right now, as of December, the last election, if you want to vote by mail, you have to re-request it.
So, but didn't somebody have to order those to my house? I mean, like,
That-
they didn't
that-
just show up magically.
So that's why we wanted legislation, because in areas, so each county is overseen by a supervisor of election per county. So if you have a supervisor of election in Broward that is not doing their job, meaning Drew hasn't ordered, we should take this parameter off, we don't have to mail. If they're not doing those cleanups, then what is your recourse? You have to say, well, you're breaking the law. Well, that's not in the law. That you, as a supervisor of election, need to do this mandatory cleanup every so often. So those are the things that we go to Tallahassee to make sure that the laws are there, so that when actions like the one that happened to you and others that we've observed, we have something that says, listen, the supervisor of election is not following the law, therefore you can have justice action done. Because all of that there are many areas that that's not done. I'm going to give you another example
Please.
of what's going on in the elections. When you have computers and software and hardware that is managing these elections, which it is, right, you have to certify these, meaning sure that you have to run a test to make sure that they don't have bugs or whatnot, right? Well, guess to what standards they have to adhere to? What year?
1937.
No, I'm going to say,
there were
because it's a
computers
computer thing, so I'm going to say, I'll say 1989.
Close.
Not bad. It's 2005.
Okay. Well, that's better because
Still
I'm
20
like,
years ago.
That shows you how weak my faith is in the system.
But that's 20 years ago.
Yeah.
20 years ago, we did not have iPads. We did not have smartphones.
Right, absolutely.
We didn't have all the technology that we have nowadays.
Right.
So those are areas where we have recognized that there are either loopholes or gaps in the system or in the processes, and that's what we've been going to Tallahassee to require that we have legislation that
So,
addresses that.
I mean, is the only real way to fix this issue if the cheaters get severely punished? Because that's the
No,
only. I mean,
there's
somebody's
many
got to
areas.
go to jail for them to stop cheating,
But
right?
you can
Am I wrong?
You can only go to jail if you have the laws that say that you're cheating. See, you can only go to jail when you've broken the law. If the law isn't written that you've broken it, then what have you broken?
It's not written
no
that you
accountability.
can't vote 5 times? It's not written that you can't vote for a dead person?
Correct, but that's on you, the voter. See, they would have to find all those voters that did that. Whereas our tackling is we just want to make sure that the process and the procedure is as tight as possible. So therefore, who's going to go and chase after all the voters? It's easier to hold accountable your supervisors of elections.
Okay.
Okay.
Well, is there a situation that can arise where, and I don't want to say liberal and conservatives, but let's say Republican politicians and Democrat politicians can actually find some common ground on a couple of issues and actually do what's in the best interest of the people? Or are they so polarizingly different that that's out the window?
You know, I wouldn't have the experience to talk about that here in Florida because the legislative measures that we're proposing are for Florida.
Okay.
Because you know each state is different. What I can tell you is that having a super red majority in Florida's House and Senate with a red governor and presenting all of these issues for the last 4 years has gotten us nowhere.
Interesting.
Very.
Interesting. So let me ask one political question.
Shoot.
Go ahead.
All
go
right.
ahead.
So is there any topic, not election security, but is there any topic, and I'll pick one that's going to lead us perfectly where we're going.
Okay.
The Make America Healthy Again thing, right? Which
Yes.
I think we should rename Stop Poisoning Our Children, because then it doesn't have any of the MAGA letters in it.
Yeah.
Right? Because some people will oppose it just because it has MAGA on it. But Stop Poisoning Our Children.
That's a huge fact
Hold
that
on.
you just said. No, what you said is true.
Okay, so Spock.
It's
We're going to
too-
make hats. Spock.
Okay.
Stop poisoning our children, because I don't care what letter you... And I'm not talking about politicians. I'm talking about regular people like
Yes.
us. Everybody should agree with that.
You would think that you don't want a poison kid, right?
That's what I'm hoping for.
You would think that you would believe that our kids are our future, and therefore you want healthy kids.
I would think that too.
I think we
So
could come together on that.
so
I think.
so
I
can
believe the children are our future.
so can we say, like, all right, we want clean air, stop screwing with it. We want clean water, stop screwing with it. We want clean food, and I don't care if you're gonna ban red dye, because I'm not buying Fruit Loops anyway. Keep the poisons out of the cows and the chickens and the fish. So, like, can we get, and I'll use Democrats, because historically Democrats are better protesters than Republicans, or at least that's what my dad tells me when he was
Democrats are
protesting.
much more organized.
When he was
Right.
protesting in the 60s and the 70s for seatbelts to be in cars,
Right.
which, fine, it's unconstitutional to make that law, but it's for the greater good, and nobody really argues that you should wear a seatbelt. It's safer for you. So, like, can we get Democrats to start protesting the minor, like, the major stuff that matters the most, so that we can get some change?
So I'm just going to say this. I think right now what is happening is that there's a lot of polarization in the country.
Yeah.
But if you look at how the American public has been receiving its information, it's been done through CNN, MSNBC, ABC, the 3 major networks.
Sure.
So it's been
Also
pretty
known
much-
as one major network owned by the same people.
Correct, because you see the same talking points on the 4 or 5 networks, right? And Fox. I'm going to include Fox in this. So what really is happening is that you have a narrative that has been set up for decades about this is the way, things are, and so it's really a mindset that you have, a cultural mindset that has been created in the population. So
Whatever
I
the
don't
other
know.
side does, we are against it.
So that's what has historically been there. Now what you have is very crafted talking points that are being spewed out by these networks, right?
That's why it
And-
sounds alike no matter what channel you watch.
Exactly. And so, that's why you have an audience listening to you guys. You're probably going against the narrative here. You're probably presenting things that are, hey, at least making me think.
We would never do such a thing.
Right?
But,
so,
yes.
so I think when you say is it a Democrat or a Republican, I think it has to do. There is a lot that is this happening right now with propaganda, because that's what is
Yes.
going on these networks.
Yes.
So I think number one, people have lost their ability to think critically. Like we're questioning whether you would want healthy kids. Isn't that shouldn't that be a de facto?
It hurts
But-
my brain to
But right now
even bring it up.
people
It
are being
should
told
be.
just because it's this person saying it, now it's bad. Just because that person is saying, now it's bad. Well, let's look at the facts. Is a healthy kid a bad thing, right?
So why are people more emotional than logical? Like, in general, when it
Because
comes
it's
to
easier.
these
It's
topics?
always easier to be emotional. Every decision that we take is done with emotion, and then we justify it.
That's a fact.
Okay.
But I tell you what, you mentioned jail. As long as we are going to sit there and pound our chest that we are the most capitalistic country in the world, where profits over anything presides, obviously you've seen this. You've seen generations of kids that by the age of 15 years old, they are morbidly obese. That did not occur in the 70s. It didn't occur. You might have had
Yeah.
one fat kid in your school,
Right.
in your
Absolutely
whole
true.
school.
Even through the 80s and most of the 90s.
But now it's the overwhelming majority of the kids are clinically heavy to obese. And of course, the mental side of it with these kids with disabilities, it's so many of them in the school, they had to integrate them back into regular classrooms, where in the 70s and 80s,
It was a special case.
it was
Special
one
class,
class.
yeah.
One class with one special teacher with an aide. Now, it's so many, they had to integrate
have
them
a
back
whole
in the classroom.
classroom, yeah.
So, and we have so much evidence that goes back and links it to the foods and all of this stuff that they're putting in and that are giving to our children and being advertised as healthy. So our networks are allowing these things to go on because it's increasing profits. The food industry is cutting every corner in the world because it's increasing profits. You can go buy the exact same product in another country and it's completely healthy.
Well,
4 or
I'm-
5 ingredients versus ours that got
Well, this-
75
you know what?
ingredients.
This goes back to so back because right now the large food conglomerates. Do you know they're owned by the former cigarette companies?
Yes.
Of course.
Yes.
And the former cigarette companies were experts at marketing.
But like 3% of people know that.
Yeah. a lot
I
of
think
people-
it
a lot of
might be
people don't know
less.
that.
Because again, you have, unfortunately, I hate to say this, but you have the American public is very naive and
On purpose.
And purposely naive. You've taken out critical thinking skills in school. Now I don't know what they're teaching, but kids are not thinking.
Can't even read.
They can't even read, and they're not even thinking. So what you have is a substandard population that isn't questioning.
You just go along to get along.
Yes.
And
And
that,
then you've been taught to we have to go along to get along.
Yeah.
So then don't put
Politically
them in
incorrect.
prison. If you poison the sky, poison the water, or you poison the air, you're actively a terrorist, and let's hang them on the White House lawn. We'll go further.
okay.
You can call me
listen,
an extremist if you must.
I'm okay with it. As a matter of fact, I
Debbie
think
may not be okay
I
with
think
it.
we should tie him to the back of a truck and drag him, but that's
There
just
you
me.
go.
But the fact is that how do you in good conscience create and sell and market a product that you know it is absolute poison? But then the people that work there will say, It's a job. This is how I make my money. If I don't do the best job I can.
And again, you could put it on the consumer. It's a choice.
I made that point
It
to you
is a
before,
choice,
but
what about the informed choice? Because how do you get? My mom did the best she could, but if you listen, my mom would not let us have sugar-coated cereal because she was told that the sugar made us crazy, but we could dump a half a bowl of sugar in our Wheaties, at least at that point. But there was a point to that because Wheaties had back then 6 ingredients to make a Wheatie. And even though you put the white table sugar in there, when you looked at the labels on the Frosted Flakes, which had ingredients that long, so inevitably she was right.
Yes.
Us taking that was right. But again, she just went with when they said it was heart healthy, Cheerios came into our house. This is how people learn. This tell a vision.
Because
is how we learn.
They did it with margarine instead of butter.
Absolutely. I
And
can't
my
believe it's
parents'
not butter.
It's not butter.
'Cause it ain't
It's not
butter.
that unbelievable.
It ain't that.
And they did it with canola oil
Ooh.
instead of you were talking about cooking
Ooh.
with fish grease or bacon grease.
Absolutely.
I mean,
tallow.
tallow.
Yes.
Yeah.
Yeah. Crisco used to be the bomb. Now it got demonized. I'm like, well, wait a
Thank
minute.
God for the internet, so we learned this stuff because it
Bring it
wasn't
back.
ever on TV.
You could have came in my house, in my mama's house. We had a coffee can full of fish
I
grease and a
think-
coffee can full of bacon grease.
I think the best thing to do is you turn off the TV.
Amen.
Absolutely. Cut the
Amen.
cable.
TV
Cut.
and then do some research. It's not that hard.
And put your phone down and go outside.
Yes.
Ooh. Okay.
I know it's insane.
Yeah. That now
Crazy
you're pushing.
ideas.
But again, the fact that cable is so high, a lot of people are cutting the cord and they are going with subscription services. But are they purposely ignorant because you're afraid to learn the truth? I personally believe that that's what it is. I believe that even when they see some parts of truth, it scares them so bad that they don't want to know more.
And you have to take personal responsibility.
Yes.
And let me just tell you, eating healthy is work.
Woo.
You have to go to the grocery store. You have to get
Yeah.
fresh things. You have to peel them. You have
Yeah.
to store them. You have to manage your fridge. It's work.
I love going to Aldi, and I was trying to buy cashews in Aldi.
Okay.
A bag of cashews.
Yeah.
And I thought that the ingredients would be, here's my naivety, cashews and sea salt.
Right.
Or cashews and salt.
Right.
It had sunflower oil and I forget what else, and I'm like, why? It's just cashews and salt. Why would you mess it up?
The best thing I can do to say to people is read the label. If
Mm-hmm.
you cannot pronounce any of those words, you probably should not be putting it into use.
Well, now that we're talking about poisons,
How many episodes have I said that right there?
a lot. I'd
Literally.
say every.
If you can't
every
read it, don't eat it.
Every 3 out of 5.
Yeah, it's a simple process.
Well,
But,
let's.
but I think it has to do also with parenting. Like I remember when my kids were adolescents, they would open the fridge and it'd be full, but there's nothing to eat.
There's
in
nothing
here.
to eat.
I'm like, because you have to make it.
Yeah. Yeah.
But
yeah.
now they're very health conscious young adults.
Yeah.
And they read their labels and they're even
Good.
more.
You didn't get
honest
one
than
to rebel? Usually when you got multiple kids,
I
one
have-
rebels
I
and
have
goes
one
the other way.
Yes, I have no, but the 3 so far so good.
Oh,
I
man,
had a
that's-
rebellious one, but he's you know
He got back on track? Okay.
yeah.
I told Vince the other day, I said, I know people are listening to our podcast because I've had 5 or 6 friends say, hey, you inspired me to eat better.
Yeah.
And
Health is wealth, and you are what you eat.
and my son is
Literally.
the biggest is
Yeah.
the biggest one for me because he came at 16 and said, hey dad, you're eating like a beast and you lost 25 pounds like everybody tells you every time you see him, like, man, you really lost a lot of weight, you look great, all that good stuff. He's like, I want to do it too. So I led by example and it actually worked on a teenager.
It's amazing.
Yeah, I know.
Well, because you were a man in his life that he could look up to.
Okay,
and
that's the
respect.
last episode.
Oh, okay,
Perfect.
sorry.
So now
okay.
that we're on poisons,
Okay.
Okay.
it's only fitting that since Debbie is back, we get an update on COVID shots.
Woo-wee.
We're not even going to get into the 72 other shots.
No,
Or we might get into a couple of them,
might.
but let's focus on that.
Let's bring her back to reintroduce your background in that,
Yes,
so that'll help
yes,
that too. So
perfect.
for
Yes.
the people that didn't see the other episode.
So my background, like many decades ago, is I worked in manufacturing for Baxter Healthcare, which is a Fortune 500 company. And when I say manufacturing,
Drug makers.
no, they don't
No,
make drugs.
they package it.
They
Oh.
make the plastics
Yes.
where the drugs go in, like your
Okay.
IV bags, your tubes.
The
I-
hermetically
I-
sealed
I use all of
packaging.
that stuff every
Yeah.
every
Oh,
time I
right.
use
your,
something.
your
it's
blood
Baxter.
bags, your
Yes.
blood bags where
Yeah.
you store the blood, your dialysis bags, the sets,
Yeah.
so
15
that's
drops,
Everything
60
a
drop
paramedic
sets.
needs.
Yes.
everything a paramedic needs. So hospital supplies.
Right.
So I was in the manufacturing side of things.
Mm-hmm.
And then I've also done clinical research monitoring, which is how clinical trials should be conducted. And when you conduct a clinical trial, you have a monitoring company that makes sure that the investigator, who would be the doctor, the patients have informed consent, and that the drug manufacturer or the company that's wanting to put the product out is doing things ethically. So that's where the monitor comes in.
Okay.
And we know from our last episode with you that didn't happen.
Well,
and that's
that was
what
one of-
raised the red flags on
There were a
COVID
few
for
red,
you.
Yeah, there were a few red flags that raised for me. So the first one really was when at the very beginning of COVID, the HCQ, which
Yep.
is the malaria pill, which has been used for decades, if not maybe a century, in sub-Saharan tropical Africa and Latin America.
Take it every week
Every
like clockwork.
week, like the Sunday pill, it's
Sunday
called,
pill.
which we know is safe. Might not be effective, but we know it's safe. Started getting demonized, and when that happened, I was like, whoa, something's wrong here. So I started to follow, how COVID was being portrayed on the news and on the
Propaganda machine.
propaganda machine. And then during that time, I was doing clinical trials monitoring, and this was a new phase for me. I was learning. So I was
Okay.
learning, that when you have a clinical trial, you want to really make sure that the women that are participating aren't going to get pregnant, because you don't know how whatever you're using is going to affect the baby's development.
Right.
So you wanted to exclude that possibility. So some women that participate on clinical trials have to have 2 types of contraception, not 1 but 2, and pregnancy tests before they start. So it's
Right.
really a really careful thing, because I don't know. Well, there was this case where women were exposed to, I think it was thialamide or a drug, and the babies came out deformed. And that's
Thalidomide.
Thalidomide, exactly. And that was one of the first reasons why the FDA came to be, actually, and be the supposedly the regulatory organism for this industry. So as I'm learning all of this and making sure that all of these things are being checked off of on the clinical trial, I start hearing that they're thinking of giving the vaccine to pregnant women. And I'm
yes.
like, and this is an experiment. This is not even an approved. Back then I thought FDA was still the gold standard. So I'm like, this is not even FDA approved. It's just an experimental usage. So there were a lot of red flags that indicated to me that something larger was happening, either very corrupt or just a lot of mistakes or lack of oversight. I didn't know what it was, but I had red flags all over the actual, I don't call it a vaccine because it's not.
It's not a vaccine.
Experimental gene therapy. That's a whole nother thing. This was the first time we were going to use this type of genetic
love this
therapy
lady.
on, it's a revolutionary mechanism of delivery.
Yes.
And shouldn't we be doing a lot of data collection and only giving it to certain population, the one that needed it the most? Why wouldn't you give this to children? So a lot of questions. So that was the beginnings of my COVID
So how
opposition.
bad is the shot? Let's get down to brass tacks. Now that we've got 4 years of information.
Oh no, we're into
you've-
year 5 right now.
But you've heard, everything from it's going to create mass genocide to,
So this is yeah.
it's not that bad to, there's lots of VAERS reports and all, there's tons of smoke and noise. What have you actually discovered through your research?
one of the things that people were told, this is in the early days, is that when you got the shot in your deltoid, typically, that it was going to remain in that area. It wasn't supposed to go all over the body.
Right.
That's called biodistribution.
Okay.
Well, before it was even approved, it was known. There was a Japanese study that was conducted, and they followed the biodistribution for 48 hours, and they found that the the substance was traveling all over the body, and then settling for women in the ovaries, and that was the highest place, and the second one was in the bone marrow. So
That sounds bad to me.
That sounds
So-
like we bringing Sam back.
So if you're having something that's depositing there, then you would speculate that for women, it would affect their menstruation. It would affect their ability, it could produce miscarriages,
Right.
anomalies, deformities, etc. That's one of the many potential outcomes. In the bone marrow, you would expect eventually, not immediately, but lymphoma, no, not lymphomas, leukemia.
Leukemia. Blood
and
cancers.
blood cancers and blood disorders. That is something that can develop from 1 to 9 years
Wow.
post-vaccination. So I just wrote a Substack, and if you look for it, it's called Anatomy of a Fallout, where it explains all of these potential ramifications of taking this.
Okay.
And then now I just published another one. It's called Code Blue, because a lot of EMTs and first responders are finding a vast difference between what it used to be pre-vax to now post-vax.
What do you mean?
So, for example, pre-vax, you would maybe respond to one acute kidney failure or liver failure a year. It was rare.
Right.
Now they're responding, I think the number was 2 a month, 2 plus a month. Cardiac issues with young people.
Oh, yeah.
You would probably have 1 or 2 a year. Now it's 2 plus a month.
Arrhythmias are crazy right now.
Arrhythmias, CPR on young teen athletes, adolescents.
Yeah.
So these are just the type of anomalies or the differences that people are seeing. Now, if this had been properly conducted, you would have any clinical trial, you would have had a follow through of every person that was vaccinated, so that you could correlate these results with their vaccination status, and maybe they're related, maybe they're not. What we do know is that these incidents have increased, and it all happens after the vaccine.
Woo! You all right, Drew?
No, I'm pissed off, man.
The other thing
This
that I
is the second episode in a row
Yeah.
that I've been, first we get Russ come in here and tell us the world's ending and the dollar's going to go away and everything's going to be tokenized and we're going to be in a control state. And now we got Debbie telling us, that Dr. Fauci poisoned us with these COVID shots, poisoned, an entire 4 generations of people with COVID shots. So I'm pissed, Vince. I want to see hangings in prison.
Everybody has a price. So therefore, somebody's a pimp, somebody's a
My
hoe.
price is hangings in prison now. That's my new...
magic,
I'm in.
The magic behind all of that was they used the scare tactic
There was fear. a
to
lot of fear.
scare the entire world. Everybody was hearing the exact same thing. And I don't care how strong your mind is. If you're hearing the same thing over and over and over again, you're eventually going to listen.
Unless you're
Well,
Drew and you're
and-
contrarian and you don't trust
No,
anything
and
you
as
see
we
or
Which
hear.
is the 1%.
What we discussed before, when you have this massive propaganda going on where people are just listening to this and eventually if you were told that the sky is green and you're hearing it on a daily basis, you might look up and say, I kind of see the green.
Power of
There's a little-
suggestion,
Right?
it's called.
Yeah.
So when you're under fear, and everybody was, and you've been locked down, and you cannot have a conversation with other people, and you're censored on Facebook, some people just thought let me just get this over with.
Yeah.
I want to thank
go.
all the people that played golf with me during the shutdowns because you probably saved my life in more ways than one. So thank you to all my golf buddies that played golf with me during the shutdowns because it kept me sane enough to pay attention. Enough attention.
Yeah. I mean, how many marriages was broken up during that time period? How
Oh,
many
yeah.
families split
Family
apart?
law attorneys were very busy.
It got crazy during that
It
time
was
period
very
because
crazy.
you're taking these people that's only used to dealing with each other maybe 3 hours a day, and now you're subject to 24 hours
Yes.
a day with this person.
Under stressful conditions.
Under stressful conditions. And you found out, you know what, I really don't like him. I don't like her. And next thing you know, boom, it's exploding. Now, in the process where you can't really go outside, you can't really find a realtor to go out. Now you got to go find a place to live. How you gonna do that? How you gonna do that? Because you can't walk outside. The fallout was incredible.
Yep.
So that's why I like the word when you use the word fallout.
It was a fallout, yeah, and we haven't even addressed that. One of the other things that I did want to bring to your attention that I found out was that the spike protein, because
there we go.
Spike,
this is what we want to talk about.
Was supposed to be what's it called? It was not supposed to be bioactive. In other words, when it's bioactive, when something is bioactive, it means that when it goes into your body, it is interacting, it's attaching with your brain, your heart, your different, wherever it's touching. So I'm not a doctor and I'm not a scientist, but I'm just thinking there's this spike protein that's coursing through the veins, and it's got these little spikes, right?
Yes.
And the epithelial, which is the cells that coat our veins and our arteries from the inside, I suppose it's kind of fragile. And you have this thing at pumping through.
Yeah.
What is that doing to your body inside? I don't know.
Well,
what I will say is that there's a lot of blood clots.
Lots of blood clots.
And the morticians, I don't know if you guys have seen this.
Please be on the same point. Go.
They have noticed that there's these like long white strands of protein that are blocking the embalming fluid. Before they would drain the body and then from the blood, and then they pump the embalming fluid. I don't know, more than that.
Yeah.
But now they were finding blockages, and when they went in, it's because there's these fibrin, protein, I don't know what, but they're long strands, feet long of strands. So they're not blood clots. There's something else in the body. It's
a protein. They're calling it part of the spike protein situation. And
so
the morticians were the ones who found it and was like, hey, this is odd.
This is odd, exactly. So that's another aspect of the whole thing.
Mortician whose family had been in the business for 100 years, they said they've never seen anything.
And he's not
like
the
that.
only one. I had a friend, because when we started hearing about that, here in Boca, and he's like, I know 2 funeral homes. I'm going to call them.
Really?
So if all this evidence is out there, and it's blatantly obvious, let's say, and there's peer-reviewed studies that say it.
No, there's a difference.
Please, educate
Peer
me.
review is part of the scientific process. So right now, when you have a new product, right, or a discovery, you put out your thesis about, this is how I found out that 2 + 2 is 4, I did the math, I published this paper. Now, another professor comes and says, let me see your methodology, let me see how you collected the information, and then that's what a peer review is.
Sure.
We're both educated.
A peer reviews your work.
Yes. So that is what you need to be able to be published in, the journal of this, the science of that, whatever. Now, that's the scientific process. And now so they make it very difficult to do these, because now, not every professor wants to review your work.
Right.
When you're going to do these experiments, it takes a lot of money to make sure that it's done properly, etc. So that's one aspect of the industry. What I'm talking about what the morticians are observing, what the first responders are, that's more evidence-based.
Okay.
In other words, I'm seeing it with my eyes. Now, if one person sees it, maybe it's an anomaly. But if you're hearing this paramedic, that paramedic, the one in Minnesota, the one in California, the one in New York, now that's where I'm saying we have lost our ability to think critically. Because if I'm hearing this from 50 people, I should be thinking there's something wrong with this. But where we've become so perverted is like, if it's not peer reviewed or science based, we're not going to believe this.
What would it take for people to believe what they're shown? Because it seems like a lot of people are still in denial.
Don't believe your lying eyes?
Okay, sure.
That's kind of it.
Yeah. It's bad, but
I don't know what do you do about that.
It's hard. So
go ahead, Vince. Tell me, man.
No, it's it's the same thing that I use when I get into the whole religion situation. When I'm like, you may have been presented with some hard evidence that what your grandmother and great grandmother taught you was not accurate. But because you was raised in that same environment, it's harder for you, even though you see the truth, you see it, you've proven it to yourself, you're still going to go down that path because
you're emotionally attached.
You're emotionally attached. And this is where everybody else in my life is going. So I'm not ready to get off that road to an independent road because I'm out here by myself. I'll just stay in the masses. And that kind of situation is what you're talking about, because there are people that learn this, that see it, that understood it. They just aren't willing and ready to separate themselves and be the outcast of that situation. It's just they're not ready, or they're not confident enough, or they haven't had enough personal loss to do it.
Or they don't want to upset the balance of a delicate family situation.
Yeah.
There are many, many reasons why people don't make these choices. And, to each their own.
Think about how your family dinners went on Sundays when you couldn't even go over there. You couldn't even.
That was a different case, but
it is, but it's not, because again, fear driven, versus now, 5 years later, 4 years later, after starting to give these shots, these truths are starting to come out and about. Do you accept them? Do you do anything about them? Or
I think it's really hard. I mean, if you've taken one of these
Yeah.
or several, and nothing has happened to you, right?
yeah.
Mm-hmm.
I think it's easier and it's more comfortable to say, well,
nothing's gonna happen to me.
Nothing's gonna
Yeah.
happen. I think that is human nature.
It is, and again, that population that had the side effects, though, they're not saying that it's okay, because their side effects they suck.
Well, what you're seeing right now, and I think that's one of the reasons why the MAHA movement grew so much, is because you did have people having these perhaps they had nothing to do with the Trump person, but they were experiencing themselves, because a lot of people in the MAHA movement were original vaccine
Proponents.
No, they were vaccine skeptics.
Oh, okay.
Yes.
They were vaccine skeptics because they had their own incidents.
And you mean in vaccines in general, not
in general,
COVID?
yes,
Right.
not COVID.
Yeah,
Just
go
in
ahead.
general, they were, they had a reaction. I know of many people that had previously very healthy toddlers, and when they received certain vaccines, then the toddlers got autistic or something like that. And you don't know if it was this or that, but when you see so many,
so then why do people fight so hard against asking the question? I think you should my parents taught me to question everything, so that's probably what made me the anarchist and maverick I am.
I think in the vaccine space, what happens is, first of all, you have physicians who are classically trained by institutions that receive a lot of funding from the pharma companies. So they're right now what we have in the medical establishment is three choices. I'm either going to refer you to someone else, we need to cut, or we need to give you some medicine. Those are your choices.
I think you're going to get medicine first.
First medicine.
Then cut.
Or
Then
surgery.
Cut. And then when
I
I can't fix it,
somebody
then I'll refer you to somebody else.
So those are your choices. It's not, hey, let's look at some journals. Let's look at what worked before. Let's look at some research in Japan or in Argentina or other places. No, people, you've lost that whole. We need to go into the journals and see what other studies are out there.
Okay.
So you've got that. Now, say you're a young parent, a new parent, and you don't know anything. Your doctor, your pediatrician says, okay, we have to go this course. Very few are going to say, I don't think that's right.
Right.
Who's going to say, I wouldn't have? I did not.
Right.
So you don't question these things. And then when you hear of someone, because you've grown up thinking, vaccinations against chicken pox and smallpox, and we saved the world against measles or
polio
and all that.
Yeah.
If one of my friends told me, well, I don't believe that, I'd say she's batshit
Crazy.
right?
Right.
At least at one point.
Right.
Until something wakes you up, until something gets to you on a personal level and makes you think, hey.
I mean, is there a way that the medical community as a whole can recover from the debacle that was how they handled COVID?
I don't think so, because when you are in the medical profession, especially the doctors.
Yeah, you're the trusted advisor.
Not only that, when you study medicine, I mean, the debt on your head is in the, like a lot, like in a million or something like that.
Yeah.
So what happens if you're a doctor that starts questioning this, but your board or your hospital or the insurance company that's now controlling the hospital says, no, you're not going to talk about that. If not, we're going to take away your license.
That's right.
Then you can't practice.
I saw.
So you've got a huge conflict of interest.
I saw a meme online the other day that says, your doctor is using AI to pass medical school, so stay healthy. And I'm like, yeah, that makes sense to me.
Yeah.
So I got a question for the both of you. Children born under 30 years old, I want to say, were the parents were offered the cocktail.
Yes.
As opposed to the old schedule of every month. Also, at that point, was a huge spike in the whole alternative behavior situations, where you had these kids that's now, having
on the spectrum or
deep on the spectrum, ADHD, all these other things. I was afraid of that. So, I mean, and thankfully, when my kids were coming, I had an old school pediatrician.
Me too.
And he was like every month.
Yeah.
We got in the car, took them every month down the road. I did the same with the grands. I said, look, I don't have but one request. And one of their pediatricians said, well, it's less pain for the kid. I said, well, I didn't die. And I had shots every month. She didn't die. And she had shots every month.
Fine.
So we're going to bring this child back every month because I don't trust the bolus of all of these things. Now, again, we're not even talking about just the major stuff, the measles, the da-da-da-da. It's all of this other stuff that they'll never even run into. Like somebody was talking the other day that the hepatitis B shot.
You only get it through sex or blood transfusion.
Why are we giving a brand new baby?
Because the theory was back in the day, you had a certain percentage of the population that this was the only time that child was going to be in a hospital.
Yeah.
And so let's give it to them now.
I thought the answer was because it could be passed from one of the parents. Is
No.
that false?
That's false, because
That's
when
false.
you're pregnant, they're making those tests on the mom.
Right.
They know if the
It's
mom
false.
has hepatitis or not.
So
Well, let me take the piss out of the flu shot then, because I have issues with the flu shot, and I've had issues with the flu shot.
that's why I've never taken the flu shot.
So
Yeah, I haven't taken
is
one.
the flu shot total bullshit?
I don't know, but I haven't taken one for decades.
I've never taken one because it was when I found out how it was created, it was last year's or the year
Strain.
before strain
Yeah.
that we're going to give you. So if that strain ever comes back, hey,
What's the point, right?
You're pretty much protected. But I have yet to see anybody take the flu shot, A, and not get sick almost immediately.
Yeah.
B, catch whatever the new strand is, and now they're waiting for next year to go get last year. You
doesn't
can't
make
get
any
ahead of
sense.
this
You
thing.
can't
It
make
doesn't make sense. It's never worked, in my
So,
opinion.
By that,
Shore up your immunity.
So
Take
by
vitamin
that
D and zinc.
philosophy, are you blaming COVID shots for all this rampant pneumonia in 40 and 50-year-olds right now?
100%.
Well, because that was another thing about the COVID shot. It's a shot that keeps on
Everybody
giving.
keeps saying, "Oh, I
It's
got
a shot-
pneumonia."
Got
It's the
pneumonia.
shot that
Got
keeps on giving.
blood in my lungs.
So one of the things that they found, when you do a clinical trial, what you ought to be doing is you ought to be also testing or doing monitoring for how does this affect your ability to respond on your immune.
Naturally.
Creating
Yes.
white blood
or your
cells.
genes. There's a genetic,
Right.
does this affect your DNA or not? None of that was done, by the way. They
No.
didn't even do animal studies. So, right, remember when I told you about the blood? Mm-hmm. How it settles in the bone marrow?
Right.
Where do you think the white blood cells are made?
in the bone
The bone
marrow
marrow.
from this conversation.
And what are white blood cells supposed to do?
They fight off infections
That's
and
their only
diseases.
job.
So would you be more prone to if you have less? See?
Absolutely. How can they produce when this
Exactly.
tainted stuff? Well, so as a person who's given thousands and thousands of COVID shots per my
I have an
occupation.
actually really good question for you because this is where I hope the audience, I know the audience is probably horrified if you took the vaccine or if you know someone that took it, you're thinking, oh my God, what did I do?
Okay.
But this is where I feel there might be some hope.
Go.
Okay. So, because we're observing that some people, nothing happens to them and others, there's some really bad stuff.
That's where I
right?
was going. Go.
So why so? So these are my speculations, and I'm going to publish on this.
Now you're talking happened to them that day or happened to them ever?
Well, so there's short-term effects that day, the next 10 days, the next 2 weeks. Then we all, some people went through that. Then you have the midterms, which is probably 2-3 years after. We're right now in the midterm, and then we're going to have the long term.
Yeah.
Now, what I will say is that if you look at long term, like the data right now, you have, I think it's, I'm not sure about it. I have it in my, I think it's at least over 1.5 million new young people or working age people, that's between 24 and 64 years old, that are claiming disabilities.
Okay.
So you're definitely seeing an uptick.
What was
on,
that number again?
Between 24 and 64 years old.
About 1.5 million.
1.5
more
million.
added people that are
Additional.
reporting, disabilities on insurance.
Okay.
So
my original
But where
point
I
for
was going
bringing
with
that
this,
up. Go.
no, where I was going with this is that you see all this. Some people have effects, others not. So this is my thought. I know I did some research on this. When you had the vaccine, it had to be transported under really cold temperatures.
Very cold. Yes.
Very, very cold. Then you, I believe, diluted it into lots, or you I don't know if you got it diluted, but regardless of that, it had to be refrigerated.
It had to be completely refrigerated. Yes.
So.
And then they had trained people who received that product and prepped that product, drew the product up, and placed the product ready to be.
And you did all of
distributed.
that?
No.
You only did the
So there was
administration
someone
of
that
the shot.
So when they drew the product out and they would place it in the different, did they do like 20 shots at the same time, 20 syringes ready
Each
to
lot
go?
had its own batch. So a lot would be the size of this table.
Okay.
And so that day, you got that lot. That was the lot you were working out of, this tall. And when that lot ran out, you were done for the day.
And when you had that lot, how was it dispensed? Was it in a syringe?
Yes.
One like 200 syringes or 500 syringes?
Yes.
And those were all stored at the same temperature?
I don't know whether syringes were stored, but I know that
The actual
the
little...
only people that touched them were the certified people who prepared it. By the time it came out, we could see them preparing it. We could see them drawing it up, whatever, and they would put their amount, put it in the basket, and then you come and change your basket out.
So when you were dispensing those, you had in your basket. I would assume you had the little vials, and then you'd put the syringe in, you'd extract it. And
We didn't do that. They
do
did it. The certified people did it. The only thing we got a basket of 30 shots.
Okay.
No, not even. Probably 20 because of temperature. So they
And then the next 20 cars that drove up, they got
not
those
even a car.
shots.
Whoever came in or whatever area in which
Got
you
it.
did it, yes, they come in, boom, boom, boom. You go get another basket.
So one of the things that I was speculating on, and you tell me if this is a possibility, is that the preparation had to be at a certain temperature.
Yes.
If not, it
Not the
degrades.
preparation, the storage of it, the travel.
Yeah, but
And
once
then
once
Once
had
it got exposed, it had to be used that day. You couldn't put it back in the refrigerator.
Okay, but when would you say you got one at 8 a.m, would that same basket?
No.
No. You had to use it within
You
a
had to
certain
use
amount?
it. Yeah, you had to sign up. You had if you was either at a place where you did the sign up or walk up, before they started drawing anything, they knew that these 300 people were here. Here, physically, we got them. And so they're coming in. So there was no waste. So
I'm not
even
saying about waste, but I'm wondering about the temperature of
but I'm
the...
saying
When it was
the
administered.
temperature would, as the people would come in, they would be drawing them up.
Okay.
Could there have been some that maybe had an extra hour? Possibly, because humans are going to make human errors. You got to go to the bathroom. You may not have put it in the fridge. You may, man, I got to go. You left it there, had to go and have your little private moment, maybe spend a little extra time on that. We don't know. But the process was delivered cold. Processors, trained processors drew the product up. And it was so bad that at the beginning, when everybody was afraid of it, you would have X amount of shots, and they would send people outside and just drag you off the street. Hey, you want to get the COVID shot? We got extra. Because they had to use it. And so they didn't want to throw it away. So they would drag people off the street and say, hey, I haven't had it. And they come in and get jabbed up real quick. And it was like, wow. That was mind-blowing to me. But that's how it was, because there was no waste. Because it couldn't go back in the refrigerator, couldn't save it for tomorrow. All that's fine, well and good. What blew my mind was I've never went to my doctor, got a shot for anything, and they said, okay, stay here for 20 to 30 minutes because you might pass out. No shot I've ever had in my life.
Yeah, I've never heard of.
Except for COVID. The recommendation was that everyone, you had to have a waiting area post injection. Boom. Post injection, you had to wait 30 minutes, and then they come and you give them the little, okay, I've been here 30 minutes. Because so many people, every 20 folks, you would hear, boom,
Keeling over.
just fall out. No big deal.
But
Whatever it was, usually they just needed to, they laid there, put their feet up, kind of got Trudellberg a little bit, whatever, gave them some water, cooled them off. They got up, they were fine. But this happened, so again, maybe it was psychological because they were scared. We had a lot of people pass out before just out of fear. But after, it got to the point where it was like, no, it's happening too much for it to be psychological. What is happening in this shot that's making these people pass out? Literally, they were drop down, they cool them off. So they didn't let them get in the car right away. So what did they know when the shots got delivered?
Somebody
that told
bring
them to make them wait before they leave.
I'm not doing
Think
this
about
podcast
that.
anymore without a bottle of tequila.
Think
I
about
can't
that.
do it. I'm going back.
We
to
already
drinking.
know that we need a post-shot room so they can recover for 30 minutes before they leave.
You know, I never heard about that through any of the media channels that we mentioned earlier.
at the beginning, one of my friends told me about the son of one of her neighbors, and he took the shot. He lived alone. He was a young man, and he's now got like he has to be on a wheelchair. Like something happened to
Yeah, now those are injuries that is sad, but you can do nothing else about it. I've got people very close to me that have also injuries from it that we can't do anything about it. They're so legally protected because it was an emergency issue situation that it protected them from all injuries.
Yes.
What a scam. I mean, but again, so these people who were passing out within 30 minutes of taking the shot, you could technically call that an injury.
Oh,
because
it
it happened
an injury.
immediately.
It is an adverse reaction.
It happened within 30 minutes. That's an immediate reaction.
Yep.
And we didn't know nothing about it. The only thing lay them there, keep them cool, whatever, blah, blah, blah. If they needed to be transported, we called them, and some people, but it was like the pressure would drop and they would just pass out. It was the weirdest thing because the vitals would be fine by the time they got to it. It was the strangest thing.
Oh dear.
So when you talk back to other blue and red people, ask them about that. Ask them did they have that waiting room and what happened in that waiting room. which made me petrified when they started when the ages began to drop, all the way down to being to the 12-year-olds.
Because when you roll
Same dose that they're gonna give me.
that's a whole nother look at your size, like your size and me,
Yeah.
right? So that was one of the big questions that I used to have. The other one was, typically when you have something that is a new technology, when the delivery mechanism is an mRNA, that it's going to interact with your genetics and all of this, you, under an emergency use, you would say, okay, who is the person that's at most risk here? And that if they don't take this, the risk of not taking it are just as equal. Those are the people that should be taking it. Not the 12-year-olds, not the 21, not the college kids. It was so crazy.
It hit a level of ridiculous that was
was
just
crazy.
unbelievable.
So-
It was unbelievable. But listen, it became the business of COVID was great for those that was producing it.
Oh, yes, it is.
Business of it was amazing.
Well, my hope, because I can tell you from the data that I'm seeing, is that those that took the shot, you don't know what could happen.
Yeah.
Because there's now the long term. You're now you're exiting the midterm areas, and you're going to the long term effects. And because there's no tracking, they might say, oh, well, that cancer that you got, or that pancreatic this, or that liver that. It could be from any other reason.
Right.
So we will not know, because there's no one that's been tracking this. But my hope is that because cold storage was critical for the preservation of the
the serum that they
exactly.
delivered.
And you have a lot of places where you had small clinics, rural clinics. They don't have those cold storage facilities.
Right.
So maybe it degraded, and maybe they didn't get the full dosage of it. What has been shown is that there were certain lots that had more of these adverse effects associated.
Yes.
Which tells me that in the manufacturing process, there was no standardization and no uniformity here, because you shouldn't have any difference in lots, right?
Shouldn't.
So there's a lot of different things that maybe either diluted or rendered the vaccine ineffective, which is a good thing. In this case, the active ingredient did not get to be active. So maybe that's why some people, nothing has happened to them. And nothing will. And nothing will.
And that would be a great thing.
That would be a great thing, where all our substandard processes.
But because the scary part was how many manufacturing plants was processing something else before COVID and wound up converting to produce, whether it be ventilators, and they were producing farm equipment. Now they're switching up. And now you're doing something that producing a sterile product, when before you weren't producing sterile products. These are things that's being used on real life human beings. That just rocked my. Again, hey, look, the ingenuity says we can do it. We can make this changeover. Blah blah blah. This is how my company can really help the world, because that owner of that company was definitely trying to make some money, but at the same time was like, hey, if I can be helpful, let me know how.
Yeah. Mm-hmm.
So it's a double-edged sword. But again, if you think about the thought process, by the time the first shots was rolled out, the first day, I already had a post-waiting room. You've never received a shot in your life that you had to have a post-waiting room for.
Because in the trials that were done before, these things were discovered and not told. So that has a whole implication in terms of who was overseeing these trials, and why did they allow this? But
if they didn't adhere to the standards during production and testing and reporting, don't they all belong in federal prison?
Hey, there you go.
I'm asking a real question.
No, and that is all why the FDA needs to be, in my opinion, severely examined and probably dismantled, because they're not doing their job.
We've known the FDA was corrupt for 100 years when they banned hemp because they didn't want to fight with the cotton industry. Yeah. Like, the FDA's been corrupt forever.
Yeah.
They're the hose.
They're the hose, because everybody can be bought, man.
Yes.
I mean, listen, marijuana is still on the Schedule 3 or whatever it is drug list. because Nixon had an issue with the hippies? Really?
It definitely wasn't that. It was money.
Well, he didn't like hippies either. But, at the same time...
Look up the DuPont company. I'll tell you exactly why it was illegal.
Oh, yeah. Well, I mean, listen, it's a whole... Again, all of this stuff needs to be revisited. Everything. And so when I hear companies like this, or even what, that's why I really asked you what it is that you did legally, politically.
No, that's not what I do.
No. I'm saying on the political side, as far as even monitoring that, because again, this list needs to be debunked so you could get pure voting, right? So that means we got to go and clean up the old stuff so we can get a new list.
Well,
same thing on the medical side. We need to go and fix some of this old crap.
Yes.
Legislatively, again, marijuana should not be classified the same as heroin.
Well, how about if they just focus on clean air, clean food, and clean water and leave us alone on the rest?
Because there's no money to make on that.
I want to be left alone on the rest.
There's no money to be made there, brother. This is where we're trying to get you to see.
I swear, every guest wants me to start a revolution. I think.
Hey, man,
I think that's what's happening.
No
They're egging me on to
to
somehow start a revolution.
So, I did legislation. Unfortunately, again, sense the frustration in my voice. It's been 3 or 4 sessions, and we still have not gotten very bare minimum requirements. So,
and this is something supposedly Republicans support.
Yes.
But the Republican politicians that are in power in this state somehow are pushing back.
Yes, or not doing anything.
That's confusing.
They're not doing anything. So I have pretty much, I still support legislation and I still am involved, but I am refocusing my political advocacy. And that is right now, if you think about what's going to happen at a national level with the Department of Education, which it's going to be dismantled. All of those federal dollars are going to come back, or not even the federal dollars, but all of the onerous of the education is going to come back to the states. Mm-hmm. Guess who controls the education budget in each county?
The school board?
School board. That's a lot of money.
Yeah.
So at a local level, school boards, county commissioners are responsible for your development or your overdevelopment, for your roads, for all of the infrastructure services. Mm-hmm. All of those ideally are, if you had good fiscal, responsible people, then we would all operate in a better way. Mm-hmm. That is not necessarily what's happening. It's just bloating. So I'm focusing right now on disrupting the industry of electioneering. Electioneering is the process or the industry of getting people elected. And right now you need a lot of money to get elected. Mm-hmm. So that's kind of the other area that I'm working on.
So you mentioned the school board thing, and mm-hmm. that's a sensitive subject to me because I've lived it, I've seen it. I lived in those areas where mm-hmm. your zip code dictates basically your success because it's going to dictate how much money that you get into your school system.
Yes.
And the poorer the area, the you're going to get the last teachers to be hired, and you're going to get the least products, the least money to go and help your system. But yet, we want all of these kids to succeed. Do you think that the money being distributed per county or per school board would perpetuate that, or do something to change it?
I don't know enough about the school boards to give that opinion. I've been more in the area of getting good people elected.
Okay. Now,
So,
that was a
yeah.
grab some crap and throw it against
Yeah.
the wall, see if it sticks, because it's a sensitive subject, because their way of getting over that was this voucher thing.
Well, the Department of Education hasn't handled it well ever.
Yeah.
That's
Right?
what I'm
That's
asking.
what you're saying.
That's what I'm saying.
DOE hasn't handled that well at all.
Right.
And I mean, like, don't get me started on the Broward County School Board because, I don't need the commissioner coming after me or whatever. But, I mean, it's bad.
The public schools are failing.
Public schools are definitely failing.
That is how it goes. So, And you have right now more administrators than teachers.
Yes.
So that's
top
another
heavy.
blow. It's very top heavy. So there's just a lot of things that need to be fixed. Teachers should be compensated more. They should be paid more.
Yes.
So there's a lot of money that's involved in that.
But the things we're doing in school haven't changed in 100 years, except we're outside less is the only difference that I see.
Yeah.
And we're not teaching practical skills anymore.
The practical skills.
So
are gone.
and then you look at, like, my wife was showing me some, I forget when they were gonna ban TikTok. There's another app that's a Chinese app.
Yeah.
And she was showing me what they're doing in the schools in China on
Incredible.
video, and I'm like, those are 6-year-olds. We got 14-year-olds that can't do that.
Yeah.
Yeah.
And China. I mean, you were born in China, so you might have. I'm sorry, wrong place.
I'm ancestrally Chinese.
But you grew up in Venezuela. You
Yeah.
told me. Okay, so I mean, is that what's really happening in Chinese schools versus here?
Oh yeah.
Like,
sure.
how can we justify saying we're the greatest country in the world and thumping our chests, and we're like 50 years behind
50.
a communist nation
Yeah.
that we despise because they're communists.
Allegedly.
And they despise us because we're not communists.
Allegedly.
But they're doing school a lot better, it looks like, at least on paper.
Yeah. Well, all you got to do is look at your higher education, see who's your higher graduates in the STEM programs. They all come from in
Japan,
backgrounds like
India,
that.
yeah,
And
sure.
so these are their education just literally runs circles around us.
So what is the incentive to keep everybody stupid here?
Control.
Okay, that's a good word.
That's a
the
good
C word comes out in
Yeah.
this episode. All
Well,
right.
again, listen. They wanted to the factory line of workers.
Well, and that was originally what the education system was.
Yes.
To prepare you, because
A
you
nation
had
of workers, yeah.
But manufacturing, and I'm a big proponent of manufacturing because that's the background where I come from.
I love it.
And I love a factory, because a factory you can have people that they just want to go in, assemble something.
Right.
I don't want to think too much. Just let me assemble, get my paycheck. I'm out of here.
Yep. This is my specialty.
This is
my
what I
spot.
like to do. There are others that can do the administrative work. There are others that can do quality control. There's the people that can do the management of the facilities and the kitchens. It's a big ecosystem, and a lot of people get employed.
But we don't have factories here
But we
anymore.
don't have any more factories.
So
That's a problem.
that's out. So why are we still sending our kids to school on an 8-hour day to prepare them for factory work that there's not factory work to be had?
That was exactly. Thank you for
That's-
articulating.
But I
much
do
better.
think that
That's what
there's
I'm here
going
for.
to
I
be a
appreciate
change.
it.
I do think there's going to be a change. In fact, I was just having this conversation with my third son, because he's looking into the financial services industry, because this is all what this country affords, provides. It's a it's a service-oriented economy.
Yes.
And I think that with the tariffs that this current administration is imposing, at the beginning, it's going to be very bumpy. But overall, eventually, because of that, you're going to see manufacturing return. I hope it returns to the country. And I hope that those then can employ more people, and you know, there's a brighter future ahead for the younger people.
So I have one question on that. Are we actually going to employ more people by bringing manufacturing here, or are we just bringing it here so that we can have AI robots do all the manufacturing?
I think you're going to have a lot of AI that's going to do it.
Okay.
For sure. You need it.
Okay.
As someone I've done factories, you have to have quality control, and there's certain things that robotics are going to do better. But you're still going to need people to do a lot of the work.
Okay.
There's just a lot of work that and it's not only a factory. You have a factory, but think about it. You have this great employment center that's the factory. Then you have the bakeries that support, and the food services that support that factory. Then you have the
Logistics, packing,
and
shipping.
and so it just brings back much more to the economy when you're making it in the country.
Are we ready to pay the wages here versus the 58 cents that it costs to get it produced in China? That's the difference.
Yes.
That's why they left in the first place. Are we willing to look at our billionaire friends and say, sorry, Bob, you can't make the profits that you've been making for the last 50 years. We got to bring your stuff back over here, Bob.
So you're going to ask the politicians that are being paid by Bob to change the rules to hurt Bob?
This is what I'm saying.
I don't think you're going to ask them
this
that.
This is what we're up against, because, I mean, if you look at it, that's what the tariff is going to kind of force you to do. If we can no longer do business with China, who I think is a 38 or 40% producer of all of our goods over here, that means we got to, in a hurry, structure some buildings, get some equipment and get it in here, and then pay these people to run it. That means Bob's 75% profit margin just got slashed more than half, because the Americans ain't working for 58 cents an hour.
I mean, I don't have a crystal ball, so I can't answer that question.
It's a thought.
You know, I see what I see, and you know, we joke about how people argue on Facebook with people they don't know about politics, they don't understand, and you know, every like, let's just split it by Trump and not Trump, right? Because that's what it breaks down to. Everybody who's a Trump fan says tariffs greatest thing ever. Trump's a genius. This is the best thing ever. Everybody that hates Trump says this is the worst idea ever. It's going to crash everything. We're going to go back to the dark ages. And then there's me standing in the middle somewhere going, can I answer this in a year or two?
Okay, so, Debbie, I want you to take the next few minutes and explain to us what this lovely book is about. Let's get the name, because we're on Spotify too. So
okay,
for our
so
listeners.
this is my memoir. It's called Beyond the Breakpoint by Debbie Faris. You can find it on Amazon. And I wrote it about 5 years ago because I was widowed 15 years ago. At that point, my kids were 10, 8, and 2. So it was very hard. That first year was awful. And my heart was, when you have a tragedy or when you have something that you do not want to ever repeat again, you tend to forget. But I found that I had kept a journal of that first year, and I could help other people who were in that place.
Okay.
So I wrote it because either to inspire you if you're going through a difficult time, or if you want to help someone and you want to understand what's going on, what are they feeling, what are they thinking. Many times we don't want to ask those questions, but we want to help. So that's why I wrote the book, Beyond the Breakpoint.
Okay.
Very cool. And it's available on Amazon, you said?
Yes. And I thought at the time I wrote it, we were seeing an uptick in cancers. So I thought, well, you know, this might help a lot of people.
Right.
Now we have
it's
a
a
whole
lot
other
more
situation.
It's a C word, just a whole different C word.
Yeah, right.
So how can people find you online?
Okay, you can find me on Substack if you'd like to read, or on Spotify if you'd like to hear. And I am Praying Mantis.
Why are you Praying Mantis? Why'd you pick that name?
Because I'm a little bug. I'm very little. But it's a deathly bug.
Deadly bug. That's what I was waiting on. I was like, you're little, but you're dangerous.
We're not judging you for picking that name. We're the podcast twins because we're identical, obviously.
Absolutely. Yeah,
so,
no doubt.
Yeah.
100 pounds apart. We're good. No worries.
It might be 105 now.
Yeah,
it might be a little lighter.
Yeah, right?
So.
Hey, Debbie, we're so grateful you came back again and blessed us with this day,
Yes.
man. What an amazing
Thank you
show.
so much,
What a
Debbie.
pleasure.
We appreciate you, and we're gonna have you back.
Absolutely.
We're gonna drag you back in here every so often.
The moment she get another good idea,
That's
we're gonna
it.
bring
Yep.
her back. So
Yep.
we're gonna make her do some more research just so she can come back.
Well, that and we'll be following Praying Mantis so
For
that
sure.
we can find
Oh,
out
yeah.
when she has a great
Listen,
idea,
I've heard a
right?
couple of those anyway.
All right.
So once again, just a reminder to make sure you guys follow us. Make sure you subscribe on YouTube. Hit the little bell icon so you can get all the latest episodes. Don't forget to leave a comment. That really helps us out a lot. Share it with somebody that might need to hear this kind of stuff or just want to hate us. They can share it to them too. And make sure all my Spotify people out there, make sure you check in, like us, and leave a comment as well. Other than that,
We'll see you next week on Podcast Twins.
Podcast Twins out.